Where else would we have this kind of toxicity on our street and allow people to keep taking it?
Memories of loved ones lay scattered in the middle of Stephen Juba Park in downtown Winnipeg, paying tribute to those lives lost to a toxic drug supply. Arlene Lascaux, one of the people behind Gone Too Soon Memorial Garden, has been calling for a safer drug supply since she lost her son to fentanyl when he was just 24.
Right now, we have a toxic drug supply on our streets, mostly fentanyl, that's killing people every day. People do not know what they're getting in their drugs.
A new national study is backing up Lascaux, which found that Manitoba is leading the country when it comes to opioid-related deaths, with the province seeing a nearly 400% increase from 2019 to 2020.
In many parts of Canada, we know that the unregulated supply is almost entirely composed of fentanyl.
The study points to a growing toxic drug supply all across Canada that is fueling these deaths, with the number of young people that lost their life to opioids doubling between 2019 and 2021. It found 1 in 4 deaths among people between the age of 20 to 39 could be attributed to opioids. Marianne Willis from St. Boniface Streetlink says in order to combat rising death rates, work needs to be done to make our drug supply safer, better fund community-based supports, and a coordinated plan among all levels of governments as well as service providers on the front lines.
It's not just people that are living in poverty and living unsheltered outside. The drug-using population has become very, very diverse. If you look at where a lot of those overdose deaths occurred, I can tell you it was likely in their own homes.
Manitoba Minister of Housing, Addictions and Homelessness Bernadette Smith says the province is focusing on harm reduction, including building a supervised consumption site, but she did not commit to making Manitoba's drug supply safer.
We're looking at partnering with community groups, organizations, people with lived experience, and what they've told us is that we need a supervised consumption site as well as drug testing machines.
I always will advocate and make sure that this stays in the news because it is the most important thing that needs to be done. It has to be included in going forward.
In Winnipeg, Edward Djan, City News.